It's all gonna melt and the planes are all gonna come back. It's not
But we can hear you.
The room's not that big.
Yeah.
Okay. Is that good? Okay.
Go ahead and get started.
Shall I? Okay.
Since we have an icebreaker anyway.
All right, well, there might be more people walking in and joining on the phone, but we will get started to respect your time. Thank you so much for being here this morning. Really appreciate it. Really excited to be here. I'm Jack Reagan-Bogan. I'm an attorney and policy advocate for a nonprofit called the Colorado Center on Law and Policy. I am honored to be joined by my co-chair, Anya.
Hi, I'm Anya Rose with Hunger Free Colorado, and I'm a policy analyst.
Let's kick things off with an introduction and an icebreaker. Get to know each other. Let's just say your name and if you represent someone, and then also the last movie you saw. So in my case, it's kind of old school, but the last thing I saw recently was Jurassic Park, which I've got to say, despite the dated theatrics, it's still very scary. Still very scary. And we'll go, put you on the spot. We'll go left.
So Anya with Hunger Free Colorado, and I think the last movie I saw was Death at a Funeral.
Andrew Stricker with Trailhead and the new Mary Poppins movie.
Was that good?
Yeah, it was fun. It wasn't the original.
Yeah.
Hi, Alexis Waitman with the Health Foundation. I can't remember the last adult movie that I've seen. Almost more than almost 6-year-old, so there's a lot of Disney.
Those count, right? So
Yeah, I think it's, yeah. Saying and watched it 100 times, but that was the most recent one.
I am Erin Ulrich. I'm the new implementation director of Blueprint and Hunger. So I'm on day 2. Yeah. Yeah. Totally feel like I know exactly what I need to do and where I'm going. Trained it. No, it's been a great first day and a half. And the last movie I watched, we do movie night on Friday nights with my kids who are 3 and 6. We watched Cloudy with a Chance of Meatballs. And if you haven't seen it, it's
I'm Hannah Flowers with Benefits in Action, and thank you for letting me know about the meeting and inviting me.
thanks for coming.
And I don't remember the last movie I saw, but I watched the Game of Thrones episode on Sunday. That counts long enough.
Hi, I'm Erin Kendrick, and I'm with the WIC program. That's Colorado Department of Public Health and Environment. And I honestly don't remember. I mean, a lot of kid movies, but I watch them half the time. I just like they're off into space. So for an 8-year-old, I'm sure.
My name is Jessie Antonucci. I'm from Denver Human Services in the Family and Adult Assistance Division. The last blockbuster I saw was Detective Pikachu.
Ooh.
Yeah.
Nice.
We all live in a world that has Pokemon. So
I'm Ken Barrows. I'm an attorney, staff attorney with Colorado Legal Services. Yeah, I seldom see movies in the theater. I did see Mary, Queen of Scots, which is several years old on Netflix, I guess, a couple weeks ago. So.
A little dark. I heard dark.
Yeah, it's a little dark. Not for kids.
And the folks on the phone, can you hear us okay?
This is Kathy Smith with Arapahoe County. I can hear you.
Great. Kathy, what's the last movie you saw?
I saw Glass.
Oh, okay.
It was good.
And
Hi, this is Oh, this is Sandy Clark with USDA FNS, and the last movie I saw was Ocean's 8. We rented over the weekend.
Hey, good morning, everyone. This is Brian Trujillo with Centaur Health. I guess the last movie I saw too was also Detective Pikachu.
Anyone else on the phone? I see some other numbers. Check your mute button. Anyone else on the phone? Maybe not.
Hello, this is Corey Wilson calling from FNS USDA, and the last movie I seen was Detective Pikachu also.
Popular one.
Next meeting. Do recap.
Anyone else?
Hi, this is Stacia Erickson with Care and Share Food Bank. And
Care.
gosh, I can't remember the last movie I saw.
Okay.
Was that everybody on the phone?
Okay.
Sandy, do you want to introduce?
Sandy Stemmerk, I'm a pediatrician with University of Colorado. Last movie was Bohemian Rhapsody. Now I just listen to Queen in the car. It's better than the news. It's
Okay. Well, we have a jam-packed agenda today. I do want to just say, since this is our first time co-chairing this group, that we really are honored to do this, but I can't speak for Anya. She knows what she's doing. I only kind of half know what I'm doing. And so with that, I would encourage you, if you have any questions or concerns or suggestions or agenda items moving forward, just please feel free to reach out to me. Let me know if there's anything I can do that can help facilitate the most productive meetings possible. And please feel free to reach out to me.
Yeah, absolutely.
Great. Well, let's kick things off just by if anyone has any updates. Anything related to SNAP or WIC or food security that might be of interest to this group, I'll open the floor. Do you have anything? I feel like you always do.
Well, is Sarah coming now?
I assume she is.
Okay, well, I'll leave the federal legislation to her.
Okay.
And I don't know, have you all met on CNR yet?
No, that's June 4th.
Okay.
That meeting. So.
Okay, well then I'll just fill in. Last time I brought up that we were hearing that the Congress was looking to take a look at a child nutrition reauthorization package by August probably, and then I would give any updates. I don't have any updates. That's still the latest we know, but again, if we learn more, we'll let you know, and I believe that group there's going to be a subcommittee that works on child nutrition reauthorization. So if you're interested in being a part of that, I think let Andrew or Kevin know, right? And they'll be meeting soon. But we'll also want to weigh in on that since it reauthorizes WIC.
Not a question, but another federal update. And I'm sure some of you guys are working on this, but sorry, I should have prepared a coherent update on this, but you may have seen the Office of Management and Budget released a request for information seeking stakeholder input on the calculation of the official poverty measure, and are looking at potentially shifting that in a way that could have pretty dramatic impacts for SNAP recipients, sort of gradually shifting people off of SNAP and Medicaid. I know the Health Foundation is interested in definitely submitting some comments on that. I didn't know if it made sense to potentially do something on behalf of the blueprint more broadly. I would imagine, and again, I need to do a little more digging, I'm guessing volume is probably helpful, as it always is, in submitting comment letters. So potentially we could do a joint letter as well as individual letters. I was curious if any other organizations are preparing anything around that.
Is it legislation around the poverty, like what is poverty level, or is it legislation around the guidelines for the specific programs?
It's actually about how they calculate inflation.
Okay.
And using a lower measure of inflation, I think because of like interest rates, but it has a big impact on how the poverty level will increase each year. So it'll be increasing by a smaller amount each year, meaning that over time, this would kick millions of people off of benefits programs just because the income limits are going to be remaining low well.
Yep.
Yeah. I know there's, I think the Coalition on Human Needs is hosting a webinar tomorrow. I can forward the information to Andrew, and then are you able to send it out to the group? Okay. I can send that out, and I'm hoping to learn more then, but I think we would want to weigh in.
Yeah, I need to learn more. Comments are due June 21st. So,
it's only a 45-day window. It's really kind of strange.
Since we're joined by Corey at FNS, I don't want to just put you on the spot, but do you have anything to add about this possible rule change?
No. Honestly, the latest information I read was an article about it, just pretty much echoing what I just heard on the phone, essentially impacting inflation and, over time that it could negatively impact some of our recipients, but, nothing official. So I don't have much to add to that.
Okay. Well, what do y'all think? Is this something that maybe the blueprint, this work group could work together on submitting joint comments? And also, if your individual organizations would like to submit one too, maybe we can put together a template. What do y'all think?
Yes.
Yeah, we probably couldn't at Colorado Legal Services. I have to speak with management, but we get a lot of funding from Legal Services Corporation, so there's some no-nos to stepping over certain lines.
Understood.
Yeah.
Sure. And with WIC, I know that there's some issues with some legislation activities, so I can just bring it back to TDPHE and see if we're able to participate or not, or what information
We've had
we
pretty
can
good
provide.
success in going through polis to be able to get it signed off on. We just have to go through the governor's office.
Okay, great.
And are you comfortable if the blueprint submitted a comment? Is that something that is it going to implicate you in any way?
I don't think that probably would. It might be a matter of me, if I were signing or part of signing something, that might be a problem. But I'll look into it.
I was gonna say, I know this is probably inherent on dictate too, probably something the governing council should talk about. What does it mean for the blueprint to sign on to something? I know I've been part of other coalitions, like All Kids Covered Coalition. They'll have like a letter on behalf of All Kids Covered Coalition, but then only individual organizations that are comfortable signing on to that and add their names. So I think there are different ways to do it, so that no one's put in an awkward situation or a situation that it wouldn't be legal with their own organization.
Great.
I'm happy to volunteer. So the Health Foundation, we do have a pretty great federal policy team. I'm checking in with them tomorrow just to learn a little bit more about this. They help us with a lot of comment letters, and I know they'd be more than happy to probably draft something that everyone could use or customize and add to it if others are, putting pieces on it. Usually Health Foundation comment letters are usually pretty high level and don't get too into the weeds on all the legal details, which some of you may want to do, but I'm happy to share what we get from them with the group if that would be helpful.
That would be very helpful. That would be great.
They're good at that.
And the volume is often determined on the uniqueness of the comment too. So sending a form letter a repeated number of times is not going to be helpful. So just creating a space where each organization can tweak it.
I always submit my comments in Wingbats font, so that it takes extra time to decipher. Thank you. Thank you for bringing that up.
Yeah, and I think, as long as, for whatever reason, they say 30% unique, sort of is the threshold.
So we can have a couple core
Yeah.
paragraphs or bullet points.
I mean, the more the better, but if you're struggling to get somewhere, that's the threshold.
Okay, so we'll keep an eye out then for an update from you, Alexis, on how we can sign on to that letter and customize it, and hopefully I'll submit individual letters if it's of interest and if you're able to. Great. Are there any other updates?
There's a group, a medical group it started with that are coming together, and they just emailed you on. The purpose was to understand the impact of what the health system is doing around social determinants of health, and really their first emphasis is on how food security, diet quality, and what they're wanting to do is make sure that they align with efforts from the blueprint, with the health department, talk about and first understand what are all the measures that are currently out there, even like the hunger-free data about referrals and eventual enrollment, the WIC data, and the state health department, the PRAMs. Make sure we get all the data that's using food security, and also make sure that we're also linking with the whole food systems network, community commons, the FAR grant, which is the tipping point grant that CSU is involved with, that's measuring health outcomes, diet quality, and food security. So really getting a scan of what's out there, understanding the gaps, and then what would be helpful to everybody in this room and on the blueprint to make sure that we're all coordinated and able to measure impact. And hopefully the desire is to have, this was Tracy Johnson's from Denver Health idea, sort of a, here's a list of metrics. So whatever your intervention is, can you try to choose from this group of metrics so that we're all comparing and contrasting? So I don't know the best way. Erin, do you have suggestions or anyone about how to get feedback from everyone in this group and the entire food systems group to make sure that we're capturing all the information that already exists?
So I was thinking about that as well, because I know I had gotten it late last week and it was due yesterday, and I was like, but now I got another email this morning and it's not due until the 29th. So I think that would be helpful. Like, I want to think through that, but I think if we can funnel it through the work group co-chairs and the governing council,
perfect.
And then, you know, if you want to seek feedback from your groups, or if you want to kind of tailor that, and I am happy to help coordinate that. But I do think it would be helpful to have everybody see those questions. The one quick comment I had, I know they're in like a Google form already, and it's really challenging to get through the Google form because you have to answer every question in order to review them. Can we pull it out into a Word document?
Oh, sure.
That's like a little logistical thing, but I started to go through it yesterday.
I'm sure
and it was like,
open,
took 45 minutes to get through the first half of
yes.
So if we can pull them out into a Word document or a Google Doc or something to send around, I think that would be a lot easier for people to comment on.
And it's okay if we share that with everybody?
Oh, yeah.
And then are these questions basically asking what type of data and metrics you're already using or we already have access to?
Right.
Okay.
And that's the first, is understanding what's being pulled by different organizations. And then the next is what are the other statewide national measures that are being pulled, where are the gaps, and then getting agreement on from everyone on, are these the correct metrics? Are we missing something?
Great. Yeah, we can share that.
Sure.
Thanks for bringing that up. I appreciate it.
Any other updates or announcements?
All right, well, the next item on the agenda is an update from state agencies. I don't think we have any representatives from state agencies here today.
Oh, yes, we do.
Oh, that's true. I'm sorry.
That's okay. This is Erin Kendrick, for those on the phone. with the WIC program at CDPHE, and I don't have a ton of updates to share, but you may have seen, I believe Kevin sent it out, the report that was just published, Making WIC Work Better. It was published by the Food Research and Action Center. So strategies to reach more women and children and to strengthen benefit use. So very interesting information in this. We didn't know it was coming out, so it was a nice surprise. It's 98 pages long, but it's got a lot of really good information. But Colorado's actually doing quite a bit of that already, which is really nice. So it shows that we're tracking nicely in terms of strategies. But we plan to dig into this a little bit more as a team and then compare it to findings from our regional tours. So we did regional tours last summer with our local agencies throughout the state, and we were, did focus groups and some surveys of local agency staff with participants, vendors, so retailers. So using those findings, we're going to dig into that, comparing them to these, and then just sort of see what maybe action steps could be or areas we want to work on to strengthen. So more to come, but yeah, very interesting information. Good examples from other states to look at.
Is that something that is public?
Yeah, it's public, and I think Kevin sent it out, but I'll double check.
Is it an 80-page report?
Yes.
Okay.
Yeah.
Yeah.
We should all have it.
The best kind of report.
Yeah.
And I think, he sent it out. There's like executive summary, so you can just look at that.
Yeah, it's all
Exciting for you, like a shorter version.
Were there any big takeaways?
I think that for us, the takeaway was, yay, we're already doing a lot of this stuff. Can we be doing it better? Of course, so maybe looking at other states that are doing something similar and fine tuning certain things that we might be doing. I'll just use our WIC referral form, for example. Is there a way to strengthen that? There's some great tips on communication, social media, outreach strategies. That we may be doing a little bit of, but could be doing better. So I just think that there's a lot of good information in there. So it's in our capacity, what makes the most sense to start focusing on. And that hyperlinks, a lot of good hyperlinks to other states' information.
I apologize, I've not had a chance to review this yet.
Yeah, no worries. Pretty long.
And you don't have to answer this now, but were there any recommendations that this group in particular could be helpful in terms of developing?
That is a great question. And I think that'll be what we kind of come together as a group when we review original findings, this report, and then what we could bring here to say, how can our partners help us? And then also looking at some of the SNAP, WIC, examples in here of how they're working well together. And maybe if we're not doing that, how could we? So I think we'll bring some more information to another meeting.
Okay.
That's okay.
Great.
That would be good.
And it's interesting that you just brought that up because I've met with a couple of different agencies that are working on wraparound services for their families. And it's hard to ask them to do two separate processes. One for, the WIC enrollment, the one pager, it's a game changer because it's so simple for anyone to do. But that doesn't take care of SNAP. So I think if this group can figure out how to do more direct links and then make sure that the other agencies, if you refer to WIC, that they're ensuring that if they're SNAP eligible, that is occurring behind the scenes rather than ask, early childhood education or doctor's offices to do both.
Right.
Or they can certainly do hunger free, which will get them to both. But I think it would be helpful to really understand how to streamline the processes and have better backdoor communication.
All right, so we're all going to read this 80-page report.
Yes.
At least
Executive summary.
in all seriousness, let's read the executive summary
Yeah.
and read at your leisure. It sounds like it has a lot of good information.
Yeah.
Thank you.
Maybe we can have a deeper conversation on that next month. And dig in a little bit.
Yeah. Well, so we don't have a representative from the SNAP division here, with the Colorado Department of Human Services. So I guess that means that we can speak on their behalf. No, but as we understand, there is a pretty extensive process that's just beginning to overhaul really all of the SNAP regulations for the state. And SNAP policy in Colorado is largely codified in rule and regulation, not in statute. And so the parameters of the SNAP program as we know it is kind of it's up in the air, for better and for worse. And as we understand, this process is going to be probably at least a year long.
Several phases, probably.
Several
State or
phases.
federal? Sorry.
State.
But so basically everything that's not federally mandated is kind of on the table. So a lot is federally mandated with SNAP, but maybe like 10%. There is a lot of wiggle room for state options, or at least how they're going to implement that, and that sometimes is in the regs. So the first phase is going before the State Human Services Board in July, was it?
I think that's right.
I believe in July. And I think last Terry said that she might be able to bring a draft of that to this group next month for us to weigh in on.
At minimum, before it's presented to the State Human Services Board, it has to be published publicly, and there's 30 days for a comment period. And the way this process usually works is that by the point in time that it's published, it's been vetted by some stakeholders, but not all, certainly not the full public. And then unless it's an emergency rule change, there's 2 votes where the State Human Services Board will vote 1 month and then to either move it forward or pause it, and then the official vote will take place the month afterwards. The State Human Services Board, for context, consists of 9 people, 4 of whom represent counties, 5 members who are appointed from the public. This is really, I think, kind of an unprecedented opportunity for us to effectuate some really positive changes to improve SNAP access and to improve the client experience. We're going to talk about that more later on in this meeting, because I really hope that this work group in particular can be a vehicle for trying to advance some of the policy goals that we would hope to see. But yeah, I think the first step is to try to make sure that the initial draft of rule changes can be presented to this group. I'm sorry that that wasn't able to occur today. But a lot of things are in play. So the way that we define household composition, who constitutes a SNAP household, who doesn't, policies around the appeals process, around notification to clients, around overpayments. So if someone's overpaid, what's their liability in terms of repaying that overpayment? A lot of these fundamental policies are going to be open to our feedback.
And a lot around how we verify. So a lot of what they're looking at is these are policies that will have a direct impact on how counties are administering the program and how people are experiencing the program. So they're not going to be like changing income limits or anything like that. They could have a really big impact on people's client experience.
One question from the client experience perspective. I guess one concern I've had with this process, it doesn't seem like there is a checkpoint with clients. Do you know if that is in the works, or if that may be an opportunity for us with Blueprint Group to encourage some, pressure testing and discussion with actual clients?
I think that would be an opportunity for us.
It seems like to me that seems missing.
I couldn't agree more. We have a great staff at the Colorado Department of Human Services today, but in the past, when these type of major rule changes have occurred, it's often a discussion between county representatives and state representatives, and clients get left out, community groups get left out, and so it's really incumbent upon us to make sure that that voice is included in this discussion.
I'll reframe that. I absolutely, we have a fantastic partnership with VHS right now, but that may be something we could help bring to the table, or say, hey, let's think about how we do bring that voice in. And I think there are lots of different ways we could potentially do that, but I feel that that's pretty important.
Well, you had some experience with that, Anya, with the Denver SNAP task force and the focus groups that you convened.
Yeah, so I think the way that we approached it for the Denver SNAP task force, which took place about over the last year and a half, and the goal was to come up with a list of recommendations for Denver Human Services to increase SNAP enrollment. We realized that as a group, we didn't have enough client input in the room as we were coming up with these recommendations. So we got client feedback later than we ideally would have, but the way we went about doing that was sort of crafting a set of really open-ended questions, but that got at the recommendations we had landed on as a group to try to gauge if we were on the right track or not, and then bring those to various focus groups at community organizations where people are already in a comfortable environment and it worked for their schedule and we were able to provide childcare and whatnot. And compensation, pretty generous compensation. So we hosted 5 focus groups to gather feedback, and that was then incorporated into the Denver SNAP task force. So we do have access to the information that came out of those focus groups, but it was only focused on Denver, and it was a pretty succinct timeline that we did that on. But I will say that I think for these types of regulations, that approach to gathering feedback is going to be more effective than here's the rule packet, because it is pretty wonky what we'll be looking at. So I think we do need to sort of find a way to boil down, okay, these are the substantive changes. What do we think about this? And then gather feedback on that simplified set. And that will also be really helpful for all of us because it's wonky for everyone.
And Human Services has also created a family advisory council that they can go to for just to get input about their program. So I think at this level of specificity, it's probably SNAP clients that you want to ask when you get to X recommendation or Y, but they could be helpful in kind of those beginning phases as you're narrowing down recommendations.
Anya, who would, is this the group that would also do SNAP benefit amounts? The Human Services, are they in charge of determining increases in benefit amounts?
Well, yes and no. So so that's all federal. That all comes from federal.
The state can't increase?
They could, but that would have to come from state general funds.
General funds, okay.
There is some flexibility though in how we implement deductions and how we calculate.
That would ultimately
increase
benefit amount by doing something.
Exactly.
Okay.
Yes.
Okay. And you could do that through the rules.
Right. And so if there's certain policies or procedures in terms of trying to capture people's expenses, whether that be for childcare or medical expenses, that could and does have a dramatic impact on the monthly benefit amounts.
Okay.
It's all based on a prescribed federal formula, but our state policies will, in practice, influence how much people get.
That's helpful. Thank you. Thanks.
So in terms of a meaningful next step to make sure that we include clients, SNAP and WIC clients, I don't know if the same sort of process of overhauling the rules is going to happen with WIC, but if we can capture some of that feedback, would it make the most sense to ask our state partners if they would take the lead in facilitating something, or do you think it would make more sense for us to just take the lead? I really don't know.
I mean, it seems like a conversation that would be helpful. Again, coming from a place of wanting to make the rule package the best possible, provide input. I mean, I think there would be ways, I would guess they would probably need some additional funding or support to do that, maybe. Or if that's not in the plan, then we could potentially come up with some alternative approaches that we think could be helpful.
I think just because having a month between when we
are definitely going to see a rule, and then when it goes before the Board of Human Services, that doesn't give us enough time to gather meaningful input. So I think that the first step, it would make sense to have that conversation with our state partners and see how they see that piece fitting in. But we could help facilitate if they're willing to work with us, especially since I think it is most effective when you can partner with people who already have relationships with clients, whether that's counties or community-based organizations or clinics.
Right, okay, well, one of us will be happy to reach out to Terry Chase, the SNAP director, and just gauge her interest and whether she would be open to either facilitating or at least attending or at least reviewing the feedback that we might be able to generate through a focus group type of a focus group. And we'll take it from there. We'll see what she says. You know, historically, sometimes it will be interesting to see how she responds to that.
And I do know that they're on a pretty tight time frame, especially for this first phase, because it implements the reinstatement waiver, which is a federal waiver they were approved for and need to implement by October. So they're trying to get it before the State Board of Human Services in July to ensure that they can actually implement by October. So it might be that future phases we have more of a chance to weigh in on.
Do you mind telling everyone about the reinstatement waiver?
So what it does is it enables cases that have closed for whatever reason, maybe it was a sanction, maybe they were slightly over income, to be reopened within 30 days if circumstances change, rather than that individual needing to reapply and go through the interview process. So it's a streamlining for both clients and administrators, and we think it's a really good thing.
Does that apply to people who were up for redetermination and failed to reapply, but like their circumstances have changed?
I think so.
I'm not sure, because there are some, oh wait, so their circumstances have changed?
No, their circumstances didn't change, but let's say they were out for redetermination and they didn't finish submitting their paperwork.
I honestly don't know if that falls under this, because there already is a built-in kind of 30-day wiggle. Good. Yeah, I don't know if you know anything more on reinstatement. Feel free to jump in.
Actually, you covered it pretty well. That's basically what it does. Some of these things that, you know, historically CBMS is not allowed for the system to reopen these cases. So it either makes the counties choose to start a certification period all over again and get a new application, or to reopen benefits and maybe issue incorrect benefits for a time period when a client wasn't eligible. So I think it's a positive change as well.
And that actually brings up a really good point, that some of these rule changes that are coming through are going to require systems changes, which it sounds hard.
So the first phase of rule changes, I think there's going to be 3 rule packets, at least 3.
Yeah, it keeps expanding, so it's fluid, it sounds like.
And so the first phase has been drafted, and hopefully we can, at some point very soon, share that with this group. Sarah, I don't want to put you on the spot, but if you wanted to comment, because I know you've had a chance to review it pretty closely. Also, if you want to introduce yourself and say the last movie you saw.
Okay. Oh, I'm Sarah Lipowitz, Colorado Center on Law and Policy. And I guess I'm watching a movie right now called Unicorn Store, which is on Netflix. I haven't finished it yet. About this woman who is a failed artist, and now she's trying to make it in the corporate world. And I guess at some point she's going to be transported to a different world of unicorns. I'm not sure. Next month I can let you all know about that. Yeah, so the second phase is going to have some of those family composition, exemption changes, the meatier stuff. This rule package, the reinstatement, I think, is the big piece that is going to be part of this that everyone would be interested in. Otherwise, there's some language changes. They're changing the term disabled persons to persons with disabilities for people first language. And they are tweaking some timelines that are supposed to comport with federal regulation. Like one that I was concerned about, but which I think is actually correct and not anything we could actually do anything about, is to change the period of time before claims that are delinquent are referred to Treasury offset from 180 days to 120 days. So
Can you explain what that means a little bit?
if there's an overpayment, the first step is to collect it from the SNAP allotment. If people are not on SNAP any longer, they can enter a repayment plan. If they are in a repayment plan and they end up not being able to keep that repayment plan, maybe they miss a few payments or whatever it is, they are supposed to get a notice first, and then it can be referred to Treasury offset, where then the counties could take some of their Social Security benefits or intercept a tax refund, a state or a federal tax refund. That period of time in regulation says 180 days, but in the US code it says 120 days. I have some concerns about whether counties are using the Treasury offset program, even under its actual regulations, whether they're using it correctly. And if people such as Karen know about cases where that's not happening, I would like to hear about them, because it seems to me, just anecdotally from what I've heard, that the counties run towards Treasury offset very quickly, that they want to get that in there. They don't want to deal with payment plans. They just want to grab the money that seems much easier to get.
So it is run by CDHS. So Treasury offset happens behind the scenes in the system, and we'll refer the claim or the amount over to the Treasury offset program. And there's a team, a whole team. When I say whole, there's 2 people that do it, but they deal with all of those claims. We do get an influx of people in the lobby, thousands sometimes for Denver County, because we're pretty big around that Treasury offset time.
Really?
Yeah, it's big. It's big. We have to staff people in rooms right around the lobby to talk to people all day long for weeks at a time, sometimes for these overpayments.
Do you all make a proactive effort to try to get people on repayment plans first, or what?
Yeah, as much as we can. This past year was a little bit different because there's another program. There's a tax offset program, and there's another program called DOOR. And recently, this program started accepting claims for cash programs, which they haven't in the past. So that was a big part of our universe this year, was repayments for cash programs. I believe our list this year was 60,000.
People?
Yes, individuals, liable individuals.
I don't know what that
That's
means.
between
Can you
all
explain more?
Programs? Yes, so that's all the cash programs. So a liable individual is somebody over the age of 18 that has to pay back all or part of the claim that's attached to the household.
The 60,000 in Denver?
Yes.
In Denver?
Because it was all the cash claims that came through that had never been referred before.
Oh,
Wow. And that's a combination of intentional program violations and inadvertent household errors and
Yeah.
agency
And
errors.
agency errors.
Delinquent claims in general, so.
okay.
Wow.
And for the cash programs, what kind of discretion do you all have to forgive those?
Cash rules are a little bit different than SNAP. So SNAP allows us to compromise a claim down to what people can pay within a 3-year time frame, whereas a cash program is sort of all or nothing. So if we meet certain parameters and rule, we can write off the entire claim. But if we don't, the claim stays.
Okay, that's helpful, thank you.
I thought SNAP also
Deserving.
had a waiver option as well.
Hardship, maybe you're referring
Compromise?
to?
Not
Yeah.
compromise, but actual waivers under the correct
Well, the compromise
circumstances.
can be a waiver.
It can
I
be.
understand.
Yeah,
I mean, they can waive the whole thing.
Mm-hmm.
It's a DHS discretion though, so I don't know
Right.
how often it happens.
It does happen. We do look at, compromising claims and all these sorts of things. Just is a hard thing because it has to be done sort of fair and equitably across the board.
Let's do it every time. across the
Everyone,
board.
Yeah.
Well, we're getting a little off track, but that's okay because this is fascinating. I will say at the end of our agenda today, we do want to talk about how this group can be a pipeline of feedback on these types of issues to the state and to the counties. And so let's revisit this actually in just a few minutes. While we're on government updates, instead of state agencies, is there anything in terms of the implementation of the Denver SNAP task force recommendations that you might want to share with everyone?
You know, I don't have any updates from DHS today.
Okay.
Sorry, I don't.
That's okay.
Yeah.
That's okay. Well, keep us up to date if there are any updates in that implementation.
Absolutely.
It was a great set of recommendations. I'd love to just hear about the progress in that.
I think it's definitely things that we're looking into every, there's a lot of them, so we want to break them down and get the ones we can. It's all important, so.
I can actually give an update because this is timely. We're launching a partnership, sort of like a pilot partnership today between Hunger Free Colorado, Denver Housing Authority, and Denver Human Services to try out what does it look like to have DHA site coordinators using Peak Pro and submitting applications and then calling a direct line to get clients into a queue a little bit faster to have their interview. So that, in theory, is launching today. But hopefully we'll learn a little bit about how that can work to have a direct county contact and trying to get other government agencies with access to or with licenses to Peak Pro.
Great.
And Children's Hospital's working with Denver Human Services to see if their financial aid office helps enroll families in Medicaid. So is there a way when they do that they can also enroll them in SNAP? They actually see probably 5 times the volume as their community navigators. So they're looking at different models where children's might actually pay for outreach worker from Denver Human Services to enroll families in all Medicaid beneficiaries and all benefits that they're eligible for, and hopefully just have same day then access if people have their documents there. Then we don't have the multiple handoffs that we've had before where people get dropped at each level. So they're beginning to look and drop that contract, and then Todd has worked with other counties on agreements since Children serves about 4 counties, and Denver will enroll no matter what county you're in if it's a family that receives services at Children's Hospital, and their primary care is over 85% Medicaid, so it's a really perfect target population to try that model. And Denver Health is also exploring that too with children. So.
Do you see that as their financial assistance office? What was it?
Yes.
Okay.
For that particular population, do you have any sense of how many people are receiving Medicaid who aren't on SNAP?
We've done the numbers in Colorado, and it's about 50% of patients that are Medicaid beneficiaries are not getting SNAP. So it's lower hanging fruit than doing food insecurity screening and connecting to resources. So it's how do we just do a better job of making sure that they're signed up for the benefits they're eligible for.
I think that's an interesting entry point as well, because you can also be selling SNAP more as a health program.
Right.
Which is a little
It's
stigmatizing.
a positive. Yeah. Are you enrolled in these programs that will help you?
Is there any,
Go ahead.
oh, please.
Mine wasn't a question on this.
Are they doing interviews on site?
Yeah, then that would be the hope. So that they would do on-site interviews. And I guess the place where they're already doing this well is the Family Forward Resource Center in Montbello has an on-site human service worker once a week. And evidently what they do is they refer to that person, and then somebody calls the household and said, bring these documents. And so they know exactly what to bring. They're ready, and everything happens within one day. And it makes sense to really target households with children since there's so many childcare. I mean, there's a lot of benefits that would really help lift people out of poverty, and they're the have experienced the highest poverty of all populations in Colorado. So.
Great. Sounds promising.
Yeah.
Sandy, did you say this pilot is starting or has it started?
No, they're just working out the details about the business agreements, the legal, and Annie, Lee, and Christina saw working on that.
I was just going to say that I think at the systems level too, the 3 state agencies are working really closely together. So CDPHE, McPuff, and CDHS, and you can probably speak better, more currently to this than I can, but on really thinking about kind of the data at the state level and how we look at matching across programs. WIC has always been challenging because we don't have some of the identifiers that Medicaid and SNAP collect. But I think being able to pilot this matching, I think they're using CoRio, the Office of Health Innovation is going to be funding a part of that data matching process just to pilot what is that percentage of Medicaid clients. They're 100% of them are eligible if they're pregnant or postpartum or a child under 5. Anybody who's on Medicaid, SNAP, or TANF is automatically eligible for WIC as long as they're categorically eligible. So that's something I think the WIC program has been trying to leverage for at least 5 years now. Of how to, the more people we can get enrolled in those benefits, the more are eligible for WIC. But really getting an idea of what that baseline is. I mean, we've compared numbers before, but we've never been able to look across a participant to see whether they're enrolled in those programs in WIC. So hopefully that will be happening soon. Whether that, I think again that's a pilot, so maintenance of that process could be challenging in the future. So what does that look like? But, the state agencies are working really well together.
Great. Before we move on to the next item, one interesting development, as long as we're talking about pilots, that I wanted to report on is that the state has approved a waiver for 6 counties to do in-reach at jails to try to sign people up. So the idea being that a week before someone's released from jail, they would apply with the goal of being enrolled on SNAP on day 1 upon reentry. And this is really a great concept, not only because it helps improve access to SNAP and food security, but it's also just one of the barriers that people who are reentering face is hunger and economic security. So this could also help keep everyone safe, since this is going to eventually reduce recidivism. I believe Denver is one of the 6 counties that have been approved for this pilot. And so I don't expect any updates today, but this might be something that could be of interest to this group in the future. If there are any preliminary results or data from that pilot that DHS might be willing to share, I'd be really
I'll
interested.
certainly take that back. Our core division in Denver Human Services has had outreach workers at jails for quite some time, but this allows us to be able to connect benefits to those clients faster. So I know that it's just beginning and kind of taking off now, but I can take that back to provide updates maybe next time.
That'd be great.
That'd be okay.
And this is Kathy with Arapahoe, and actually we've already been piloting it prior to this waiver going into effect, so I'm happy to get some numbers as well. We've been, for actually about the past year, able to do this 7 days ahead of time in our jails, so we can get some definite numbers as well.
Thank you. That'd be so great.
No problem.
Okay. All right.
Well, it sounds like we don't have much of an update on the child nutrition reauthorization subcommittee, so we'll do that next month. Hopefully we'll have some news. Sarah, did you want to talk about the Improving Access to Nutrition Act?
Yeah, I can do that briefly, and I also have a second thing to talk about as well.
Okay.
So the Improving Access to Nutrition Act was just introduced in the House on Friday by Representative Barbara Lee. And the idea of it is to remove the time limit for AVODs. Whoop, whoop. Whoop, whoop. Yeah. I don't know that we really expect it to go anyplace, given how things are right now, but it could get through the House at least. And so
I know it's a nuanced issue, but can you just explain what's an AVOD and what are the time limits for people who may not know?
Sure. So the group of people I'm talking about are people who are considered to be able-bodied without dependents. And unless they meet a waiver or some other exception, they can only receive SNAP benefits 3 months out of a 36-month period. And Colorado has adopted some ways of exempting some AVODs and has tried, I think, really hard to do that. But there was a 15% just across the board waiver you could use for whoever you wanted. The new Farm Bill reduced that to 12% from 15%. And then folks here have been instrumental in advocating for things like, exempting homeless folks and, some other populations. But, Representative Lee would like to see there be no time limit, and I'm guessing most, if not all, of the folks in this group would agree with that as well. So Colorado Center on Law and Policy has submitted a letter in support of this bill, and some other agencies have done so as well. If anybody would like to do that, I have information on how to do that if you want me to send that out. The second thing is a proposal by the administration to change the way the poverty level is calculated.
We talked about that, sorry, first couple minutes of the meeting.
Oh, okay.
But if you have, we discussed trying to put together a letter on behalf of the blueprint, and then also encourage individual groups who are interested in submitting a comment. But if there's anything you'd like to add to that.
Well, I don't know if you already mentioned that the Lynn Network's having a call about this tomorrow.
I have not, no.
Okay,
I
so.
don't know if it's the same. I was gonna send out, is it the Coalition on Human Needs webinar tomorrow, or is this a separate?
Actually, no, I think you're right.
Oh, okay. I'm planning to send that to Andrew to send out to the group.
Okay.
So hopefully we can get on that, because this is complicated.
Right, and I'd like to see them get buried in comments like they were with the ABOD rule. And everybody who's already done a comment on the ABOD rule earlier this year, you can just repurpose that for Representative Lee's letter. That's what I did with mine. I just kind of cut it apart and put it back together again. So all the information's already right there.
So, as Sarah mentioned, basically this is the work requirements for SNAP, where if you're not working, you get 3 months and then you're off. If you're able-bodied without dependents. I agree with Sarah's assessment. This is probably unlikely to pass the current Congress, but I think it's still important for groups to express their support for this. And so to that end, I don't know if there would be any interest in this group in having Sarah share her letter as a template.
Oh, sure.
Is that something that folks might be interested in seeing?
And I can circulate that in the same way that I'm gonna circulate the draft that you're putting together on the inflation.
What are those comments due?
Well, this is a bill in Congress, and so it's probably going to sit unscheduled in a subcommittee for a long time.
But also, if you have relationships with members of Congress, you can reach out directly too.
Yeah, I think our goal, it'd be great to get even one member of Colorado's congressional delegation to voice public support for this, even if it's more symbolic than substantive. And so maybe we should target our outreach to our state's delegation. What do you think, Sarah?
I know at least one member of our state's delegation is on that subcommittee, Joe Goose.
Okay.
So he would be a good person to reach out to. And I'm sure there's some other likely targets as well.
Great. Well, do you mind if you can send me the letter you put together? We can send that out along with contact information for how to reach out to Congressman Goose and others.
Sure. And Western Center circulated their letter, and their letter is also great. Can send it as well.
Great.
Shall we move on to our strategizing?
Okay.
All right. So we discussed that a lot of the conversations we've had in this group so far have kind of been focused around two themes. One being, how do we actually increase enrollment? How do we actually get the applications done and processed that will reach our goals? And sort of parallel to that, we've talked a lot about
the connection between that and the actual experience that clients have. And I think sometimes our conversations have gotten a little bit stalled because we've been trying to knit those together at all points of saying like, well, we need to do the applications, but we can't forget that then this experience is really challenging. And I think that's absolutely the case, but we think that perhaps what this group could do is come up with sort of a set of recommendations or requests that fall under the umbrella of increasing enrollment. So that would be to do with outreach, to do with how do we actually get folks into the program. And then another set of recommendations, probably policy related recommendations, a lot of them, that fall under the umbrella of improving client experience. So we wanted to throw that out as sort of a structure to the group, to structure future brainstorming, and the conversations we have, and hear, first of all, what do you think of those two buckets sort of shaping our conversations as a group? You think that will cover what we can work on as a work group? Is there something missing?
I don't know if there's anything missing. Yeah, I think some of our clients, you talk about client experience, it's difficult for them to have one because they may be house-ridden more or less, and they really don't have trouble going around. So I think it's important because what we see is a lot of clients who, I mean, we may look at it as like, well, if we were doing it, but they're a lot lower functioning than a lot of, in my opinion, than a lot of us. So I think the client experience is important to consider always.
I like it, maybe to your point, when you're looking at kind of what outcome measures look like for that, then you have some kind of equity measures embedded within that of, which you can look at a population level estimate, and if we change Denver, we might change the whole population. But do we really want to reach rural areas? I mean, I think breaking down the data with some of that focus would be helpful.
This is really a unique opportunity to have this much expertise here at this table together with the shared goal of trying to reduce or end hunger. And so we spent a lot of time trying to figure out how do we harness this potential in a way that's going to really be meaningful and productive. And to date, this group has already done a lot of really helpful information sharing. We've worked on federal comments. I've learned a lot from this group, but we were trying to vision what tangible work product can this group put together, and what policy changes can we support together that are really going to move the dial. And so we thought we might eventually within really the summer, want to advance 2 different proposals to the governing board of the blueprint, and with the hopes of getting their blessing and making this official. One that has to do with access and enrollment. And so that one may even carry with it a possible funding request if it could be helpful. But it would try to address the application barriers. Who are the populations that we aren't reaching? Why aren't we reaching them? Client experience is really a huge umbrella, right? But it includes things like liability for overpayments. It includes things like the stigmatization and the interview, not the interview, but the recertification process.
Maximizing benefit amounts.
Exactly. And so we're trying to figure out how do we leverage this group most effectively? And does it make sense? Is everyone interested in both of these areas? Does it make sense for us to have subcommittees? Structurally, what would people prefer in terms of trying to move forward with these 2 goals? I mean, is there anyone here who's interested in one of these 2 areas but not the other? And that's okay if you are. But we're just trying to figure out if we need subcommittees, or if everyone's interested, then we can maybe devote a whole meeting in the future to one of these, and then a whole meeting to the other, client experience or enrollment.
So would you put recertification with increasing enrollment in recertification, or that's what the client experience, I think?
So I think that different aspects of recertification could probably fall under both umbrellas.
Right.
On the one hand, last meeting we talked a lot about how could outreach improve the recertification process for clients, and I think that would probably fall under increasing enrollment. But at the same time, we could look at things like improving the recertification form, which we also talked about last month. And I think that might fall more under the improving client experience umbrella. So I think some of these things, there's going to be overlap, and both will inform each other. So that's part of why I think it's good for this group as a whole to be working on both. But also, if this separation feels unnatural, or we find that it's actually sort of stunting our progress, that's helpful feedback as well.
I was gonna say, I really like the two categories proposed, and I really see them interconnected. So I guess I would have a hard time separating the two. I think if we're improving enrollment, that also requires improving the client experience. And I do think, just looking back and what was outlined in the blueprint, I do think this work group is going to be pretty heavily policy focused, just based on some of the systems changes that will probably need to occur. So that excites me personally to be thinking about, what are the near term shifts and opportunities, but how I think we have a luxury, and again, we do have amazing expertise around this table to think about what the future could look like and to start building out that policy agenda that I think we could gain a lot of momentum around. So I like it.
This isn't necessarily about content, and this is something that I'll talk to you guys about when I meet with you individually, but I think adding some structure to the process of having work groups kind of define out what their action plans look like, and having everybody have measures and timelines and what resources they need to be able to accomplish some of those activities, I think will be really helpful, both to guide the group, but then also to guide a kind of cross-group work, because I think the child nutrition goal is also focusing on how do we get people more enrolled in, or how do we get more kids enrolled in school lunch programs. If they're enrolled in SNAP, they are automatically eligible for school lunch. So if we want to target some of those counties that have really low school lunch enrollment for SNAP enrollment. So I think that there's going to be some cross goal groups or cross goal work. But I really see that as my role to connect. But I think if we can get some structure around kind of what the activities that each work group wants to focus on, we can start to identify kind of opportunities to align across the goals too. So.
I'm glad you said that, because the whole thing with marketing, it can increase enrollment. So,
public perception.
And how do you do it to different groups? And it seems you have to do it together. Yes. That's where it gets complicated.
Yeah.
Okay.
Maybe it is. I mean, since they're all interconnected, maybe there are bullets to call out when we do anything. Have we addressed the client experience? I mean, making sure that we've addressed the client experience, the marketing, or just the different things that we'll need to do to be successful.
Yeah, like the client experience is a component that you're including in the access and enrollment and retention.
Right. Yeah, that's something that I think about a lot, of making sure that we build feedback loops for client experience into all of our outreach and into all of our enrollment efforts. So I see that improving client experience piece as being very ongoing and reliant on the work we're doing to increase enrollment. And maybe that's also another conversation to have specifically with outreach partners about sharing best practices or ideas about how we're collecting feedback and client experiences, because that should really be informing all of our work. And I know that's something that we've touched on, of how do we get the client voice to the table in the best way. So I think that can be part of our conversation as well in this group, since we do have so many outreach partners at the table, and counties and state agencies.
So how does everyone feel about, in the future, having 2 different brainstorming sessions where we bring all of our wish lists and goals, one with respect to enrollment, one with respect to client experience, with the ultimate goal of trying to put together a very specific policy agenda that we can rally behind. And if we have the blessing of the governing board here at the Blueprint, then maybe we can leverage that with our state and county partners to try to see some meaningful policy changes. Does that seem like an appropriate function of this work group? Or if not, that's okay. I'm just curious what folks would like to see us do. I mean, right now we've been a great repository of information sharing, and that's been helpful. And if that's the primary purpose of this work group, then that's okay. But I think we do have potential to.
I need you guys.
Okay. And these are pretty meaty topics. I mean, under client experience, that includes everything from the work requirements and the different exemptions. That includes the overpayment policies. How far back do we calculate someone's debt when they were inadvertently overpaid? I mean, there's so many different issues. And we thought maybe it would be helpful to have 2 separate meetings, one for each. What do you all think?
I guess I'm thinking about, like in terms of like the client experience or the program quality and enrollment, like both programs are governed by a pretty hefty set of federal regulations, which are different. And so does it make sense to have, I mean, I think there's absolutely crossover, particularly when you get into the enrollment piece of like, how are we streamlining access to all programs across the board. But when you get into like the nitty gritty of like SNAP rule and regulation, it's going to be a different group that kind of has expertise to dig into that versus WIC role and regulation and what are the opportunities.
Yeah.
They feel like a little bit separate, but I don't want to separate them out too much either.
So you're touching on what we wanted to get to at the end of the meeting as well. No, it's great.
I have to leave soon. Sorry.
Well, thank you for bringing that up because I think we have realized that there is, those are different expertise in the room, and I think a lot of our conversations have been heavily focused on SNAP. And I think part of that is I can say for myself, I know less about WIC. And so we did want to discuss at the end of the meeting how we want to incorporate WIC, because we want to make sure it's not getting forgotten in some of these conversations. And there might be different questions we need to be asking for that program. But I think if we can table that for a moment and come back to it, I'll be thinking about it.
Well, let me just do a pulse check. Is meeting once a month optimal for everyone? Should we be meeting more frequently, less frequently? I mean, the only artificial constraint we have is just the state's timeline for making some of these rule changes. And we don't want to be so deliberative that by the time we come up with the policy agenda, the window of opportunity is closed. And so we're trying to figure out timing-wise when it would make sense for us to have these nitty-gritty, weedy conversations about policy goals so that we can hopefully be out in front of the state. If we do have a set of policy recommendations, we want them to have those before the rules are settled.
Is there a way we could do work between meetings that wouldn't require, gathering information and then using the meeting time to bring everyone together on the different recommendations and just then prioritize them? I don't know. I'm just trying to think of, rather than trying to force more meetings, is there another way to do that so we're better prepared at the meetings?
I think so. I think so. That sounds like a good idea. I just wonder what that would look like. I mean, we could circulate a Google document and we can start brainstorming if people have, their 5 top policy changes that they would hope to see. Some of these are not going to be federally permissible, right? There's a lot of things I'd love to do that we just can't, but a lot of them we could do. And I wonder if there's a way that we can remotely aggregate those ideas.
Just because they're not permissible now doesn't mean they're not potential advocacy opportunities for the future.
That's true.
That's a good point.
Right. The nice thing about brainstorming is there's no bad ideas, right?
So it sounds, would there be interest in starting that brainstorm between meetings, having the opportunity to sort of submit ideas and have a starting point at our next meeting?
Yeah.
Okay, so we could look at a way to start collecting that over the next month, with the goal of having a more robust brainstorm session at the next meeting. And then I know that other work groups have used the in-between meeting time to then prioritize ideas, but I'm interested to hear, does that feel like the best way to prioritize for this group, or would you rather be doing that when we're all in the same place?
When we're in the same place, because then we could hear different perspectives.
Okay. So maybe a combination of the two, of starting that prioritization conversation when we're all together, having time to sleep on it, and then maybe submitting final thoughts of, after thinking about it in our conversations, I think these are the top 5 priorities, so that later in the summer, we can actually be solidifying a policy agenda. Does that sound?
And it might be moving too quickly, but if you're brainstorming over the next month and you come to the next meeting with a full list of kind of brainstormed ideas, you may be able to prioritize in the next meeting and kind of walk away.
Right.
That's kind of what I'm thinking. Yeah.
Some next steps.
Mm-hmm.
Well, maybe if we could have some help from our trailhead partners, maybe, maybe what we can do, if everyone doesn't mind, just a little bit of homework, is we can just circulate a real basic poll where you might be asked to provide what you think are the top barriers or the top issues with both enrollment as well as client experience, as well as any specific policy changes or solutions that you would hope to see.
Mm-hmm.
And then what we can do is just consolidate that list with the idea that next time we meet, we'll have a list of different ideas and we can start talking about what is federally permissible, what is our top priority, how do we see the potential to consolidate this into a concrete policy agenda that we can eventually move to the governing council for hopefully to get their support. Does that sound good?
Yeah, and then maybe towards the end of that meeting, spend the last, half hour or so talking about prioritization. And then between the June and July meeting, asking for you all to respond to either a survey or some way of actually solidifying what we want our priorities to be.
Are you talking about state policy and rule changes?
Primarily, but if there are county practices that you think would also be beneficial to include, I would encourage that as well.
Yeah, I was just wondering, I could almost see like there are probably some federal issues that we may or may not want to tackle just based on feasibility, certainly some state opportunities, but then there may also be some local policies and practices, and then probably also teasing out what would be legislative versus regulatory, and kind of brainstorming like what's already in the works, what's happening, what would be our pie in the sky dreams of what we might be able to someday achieve, and then what's actually like feasible and kind of thinking about there's a lot there.
Yeah, so it sounds like the first part of our priorities conversation will have to be around how we're going to prioritize. Is this going to be a combination of feasibility and equity and impact? Like what are the metrics we're looking at here?
And viability.
To decide.
Yeah.
Right.
Federally. No offense to our ethnicity.
But it does seem like there's a state opportunity right now.
Right.
Well, what's really unique about this group is that you have people that work on the front end with the hotline and the very first barriers to enrollment. And we have people that work in the back end where people are being kicked off or they're having their benefits reduced. And so this is really a unique opportunity to try to tackle SNAP access and client experience from both angles. Is there anything else that you would hope to see from this work group or that we can do to make this as meaningful as possible?
All right.
All right.
Sounds like we have a bit of a plan.
In fact, I do know, like in the early days of the plan, there was some consolidation, like what other states have done, and there may be some other documents we could dust off
look at
Spark some ideas.
Yeah, just because I mean, I have a couple ideas, but I'm sure there's a lot out there that I don't even know.
In full disclosure, at CCLP, we do have a SNAP policy agenda already. And part of me would love to share that, and if it'd be helpful, I can. But I also don't want to anchor this discussion just with our own personal priorities, because I really want this to be a policy agenda that comes organically from this group. And so I'm happy to share that if it would be helpful, but I'm also a little leery too, because I don't want our policy agenda to overtake this group.
I think it'd be important to see what you put together. And then, yeah.
I mean, it's in the same way that, WIC is going to share out, what are the strategies that they think are most important to focus on. Hopefully SNAP would be doing something similar. I think all the groups kind of sharing what they've decided to focus on. I assume you went through some sort of process to get to a policy agenda. Like you sitting
Well, I
in
leave
a room.
these partners a lot to figure out what the issues are. Yeah. Okay, well, that's something I'm happy to share. Just with the caution that it's just the work that we've outlined to date, and that I don't expect it to become the agenda of this group necessarily.
Do you guys have some sort of repository for information, like a driver? Is there? I know there's the website, but that's not necessarily appropriate for everything.
We haven't been accumulating things in a single place to date, but there have been discussions about where to do that and how to do that.
And what happened to what was submitted through, early on we had an asset submission form. Do you remember that?
Yes, I do. That information was aggregated to some extent. It hasn't been redisseminated to date, but we do have that.
Okay. It might make sense in preparation for next meeting to send that aggregated information out. And for those of you who are newer, it was a form that just allowed different members of the group to submit information about resources they had or were working on, whether it was a pilot program or a report that they put out or a data set. And I don't know. Yeah, so we'll see where that's at. But that could spark some ideas, hopefully. But it sounds like we need some sort of central location for all the information that this group could access. Okay. And I have a question. Would it be helpful for this group if outreach partners like Hunger Free Colorado or like Benefits in Action were to find some way to share out sort of the stories we hear through our work? I think I'm sort of experimenting with different ways to collect that in a way that's not too burdensome for our navigators, but also captures what we're hearing every day a little bit more methodically. Right now, that method consists of a lot of sticky notes, but
Aggregate those.
yeah, I want it to be used for something, and it seems like this group would be a good avenue for sharing that. I don't know, does Benefits in Action have any way of collecting client feedback?
We're kind of working on it more in our process. We're a little bit new to the SNAP world. We just started in October.
Okay.
But we're working on a follow-up process where we follow up with each client 6 months from their application date. And with the follow-up, kind of having a few questions that we ask each client. And, what did you think about our services? Like, do you have any recommendations for us? Is there anything that you thought was missing or resources that you wish you would have had? But that's something that we're still kind of trying to perfect before we, and like we are barely 6 months into the SNAP program.
Sure.
So that really isn't completely on its feet yet, but yeah, we're working on it for sure.
Great.
And I see a lot of people too, just do applications myself, so I'm trying to make note of things that I find, comments that I hear from people that I find interesting or new, just new ideas from people that I've never thought of. So try and maybe get better at compiling that into a list. And
Okay. Yeah, maybe we can talk about how we can collect that and compile it.
yeah, that would be a good idea.
Yeah. Right now we're experimenting with we have 3 giant posters that people stick color-coded sticky notes on, and we're trying breaking it up between misconceptions, barriers. So, and this isn't specific to just SNAP and WIC. It could be that you don't have a pantry within 50 miles of you. And then actual program experience. So especially that last piece, I think, could be really informative to this group. So this is the first month we're trying that. So I'll try to bring that back next month.
Hey, this is Corey Wilson for FNS. I conduct local program access reviews. And so what we try to do for those is we just review a local agency to see if there's any barriers at the local agency level to clients. So we'll pull a few clients, speak to them, document some of their responses. But a lot of it has to do with how they're interacting with the program in a regulatory way. And that's what we're looking at it. So it's not necessarily, hey, what's your overall experiences? It's are you meeting or is this office meeting requirements to make sure that you get benefits in a timely, error-free manner. So I know those are certain things that we do to document the client experience at the local office level. I'm not sure how much that would be a benefit. And then also we reach out to advocates and we try to, just speak to some of the representatives there to find out, if there are any trends going down in a specific area of the state. And so we'll document those as well. We'll compare that with some of the data that we have on our level in order to kind of, whether we want to choose a specific location for a review. But like I said, I'm not sure how much that would be a help because, we're not talking to clients about their overall experience and asking those open-ended questions like, how is the process, and having those in-depth discussions, because during that review week, we have a lot of different areas of the SNAP functionality that we have to review. So it's probably like 5 questions at the most that we sit down and ask those clients. So I'll see what I could do as far as having us provide some information of what we're seeing from some of those. I do have a couple questions though that were centered around the work groups, the 2 work groups that you guys were thinking about breaking the work group into for brainstorming purposes. And it's just complete curiosity. So the first one was increasing enrollment. I'm just curious as far as the work group or who's ever on the phone, how do you guys measure participation in SNAP and WIC right now? I know what we do at the federal level is we use participation data, but that data is old, like super old. So it's always interesting hearing how those clients are who should be on the program that are not are accounted for. As far as the other work group, I was kind of curious which is improving client experience is pretty much, what data sources do you guys rely on as far as capturing that client experience? To me, it feels like we have different systems that we do user acceptance testing on, right? And so before that system could go live, we test that system in so many ways. So I was just wondering, is there anything like that for the actual client experience where, work groups, states, counties would actually look at the client experience of something before it's rolled out, or, maybe a current process that's going on now? And that's all I have to say.
I have a question for you, I think. I've been using the FNS Program Access Index as a measure of the percentage of people who could be on the program and versus how many actually are. Are you saying that's not an accurate measure? Because
I'm not saying it's not. I'm not saying it's inaccurate, but most times when that comes out, it's older data, and so I think when I speak to a lot of our states, and we ask that, are you using that index? They say, well, hey, a lot has changed within the last 4 years, so they don't rely heavily on it. And so we still use it. It's still something that I will use when I'm conducting a local program access review or preparing for a review. So it it has been accurate in some sense, but I was just wondering if there is updated data out there that's something that is a little more current, and how do you guys apply it?
Corey, first of all, thank you so much for offering to try to share that information. I know it's just a piece of the client experience, but having some of that information that you mentioned would be really helpful. I think would be really of interest to this group. I'm just going to address your second question, which is what kind of data, what kind of metrics do we use to evaluate client experience? The short answer is we don't have anything yet. I mean, that's one of the first things that we would have to establish as part of this group. I would say that just from my perspective, I would be interested in looking at things like churn. So how do we measure churn? How many people are taken off the rolls only to have to reapply within a certain period of time? I would like to look at overpayments. So how many people are subject to overpayments? In Denver, it sounds like 60,000. Not for SNAP, for cash, for cash.
Right, because those are cash clients as well.
How many people incur overpayments and what's the amount of those overpayments? I would like to look at average benefit amounts. So are people getting the most that they're entitled to? How many people are receiving the standard medical expense deduction or the homelessness shelter deduction? How many people are getting the most benefits they're entitled to? Sanctions. How many people are sanctioned? I want to look, and to that end, how many people are able to participate in the work program on a voluntary basis? And then finally, just overall client satisfaction, which is very tough to measure. I don't know if there is quantifiable data, and that's, to Alexis's point earlier, that's the big overarching question that may only be addressed through focus groups and through client surveys.
Okay.
That's just some metrics off the top of my head. I'm not saying that these are the end all be all or even the right metrics. I think it's a great question.
Mm-hmm. And I can speak. Oh, go ahead.
No, you first.
Well, I was going to speak to the first part of your question about what metrics we're looking at for enrollment as it currently is. So if you had a comment on that client experience piece, go ahead.
Oh, no. I was just going to follow up to pretty much just say, those are some great conversations, some of them which we have conversations at the federal level. Honestly, I'm not sure how privy I am to share some of that information, but that is something that I will definitely come back and to my office and see what could we share within the work group. I know we had a great in-depth talk about churn last year, and actually had some reviews surrounding churn. And I think we defined it as people who were on the for me, SNAP, people who were on the program, who were either terminated or closed from the program and re-entered within 120 days for whatever reason. And so we really looked at that as well. So I think we may have some data. Like I said, from a federal partner standpoint, though, I'm not sure what I'm allowed to share. And I know there was some discussion about, what policies that we may be able to support as a result of that. I just want to give a federal perspective, and I hate to, be like this. I definitely would love for us to be hands-on as possible and give our opinions. But, the capacity that I work on is, I go down to the local level or the state level, we do, and we identify certain things that, are requirements and certain things like that. So, that's another conversation that I think we have to have at Mountain Plains Regional Office to say, what type of information can we share? And number two, could we support certain things without worrying about, adding bias to, I guess, our position, things like that. So those are things that I'm definitely going to take back to my office.
Thank you. And to speak to the first part of your question, I don't have a good answer for what we should be using. I know that the blueprint originally, I think, was using the program access index, which is a pretty brute measurement it's kind of a proxy measurement, really, because what it does is it compares the population that's enrolled in SNAP to the population from the American Community Survey that's estimated to be at or below 125% of the poverty line. So there are a lot of caveats to that. One being, for a long time, the gross income limit for most people is actually 130%. So it doesn't capture the folks in between 125% and 130%. It also doesn't take things into account like what expenses that household has, what their actual, whether they would actually be eligible for benefit amounts. Also, until June of last year, older adults and folks who are disabled were eligible at 200% federal poverty level. In June of last year, that changed to actually most people in Colorado could qualify at 200% if they meet some other requirements after deductions. So that's why that program access index, or PAI, is a really great measurement. It also doesn't take into account someone who might be under 125% of the federal poverty line, but let's say they're a student, and so they're ineligible because of student requirements. So it doesn't have as much detail as like the participation rates, which FNS calculates. I think that's, or is it Mathematica that you all use? But there are kind of pros and cons to each. So participation rate is typically going to look higher. I think in Colorado it's about 74% right now, as opposed to program access index, which is at about 60%. And I believe that uses like quality control data. So it looks much more closely at whether households actually qualify, but it's older. So the latest report, Corey, is it 2015 now or 2016? Do you know for participation?
I want to say 2015, but it could be 2016. I know I rely on that often, and when I look at the year, I'm like, oh wow, that's not current. But continue.
Okay, so whereas as soon as you have American Community Survey data out, you can calculate the program access index. So at Hunger Free Colorado, we calculate program access index for counties, which again, we know isn't a perfect measure of eligible, not enrolled, but I like to think of it as kind of like an impact measure. If this is a program that is supposed to be serving low-income individuals, how well is the program working there? It's not necessarily a perfect reflection of how a county is administering a program, but I think it is reflective of how well a program is serving that particular community. So that's the way I like to think of program access index, but I realize that's not ideal for this group where we're trying to say, okay, there are this many people that we're trying to target. How are we going to do that? So, and then the other piece that I want to raise just about participation rates is they are more accurate, but they also have a pretty large margin of error. So when we've looked at the possibility of doing that at a smaller level, the margin of error at like a county level for something like a participation rate would be so large that it for most counties, that's not really useful because we have no idea how accurate it is.
Right.
So Corey, if you have recommendations for what a good metric for us to be looking at would be, I'm really open to that. I don't have a solution here, but that's sort of the thinking I've gone through. And we currently use Program Access Index where we can, just because, we have it from 2017 at this point at a county level. We share the margin of error on that because we know it can really range. But it is really important to realize it's not eligible, but not enrolled. It is a measure of impact.
Right. Yes, absolutely. And, what I can do is I don't have specific metrics off the top of my head, to tell you the truth. Those are the things that we rely on heavily. Aside from getting down to the closer to the ground, those are the only ones we really have, and that's why I was really asking you guys from the saying, hey, what type of data have you guys created, something that is useful and a little bit more up to date and a little more accurate. I think that's a discussion I could have on my level and just, see if there's anything that we could use. Other than that, when I go down to my local program access it reviews, it becomes more about, were the benefits timely, and reviewing the cases and making sure that they go through the proper channels or processes in order to meet all of our federal requirements. And, of course, we use a lot of error rates and things like that to determine whether the client had the optimum experience and if the benefits are being calculated timely. But as far as, program access index and the participation rates, that's pretty much what we rely on. So I was hoping that you guys would help me out, which you guys did, and I really do appreciate you guys explaining all that to me. It was very educational for me. Learned something today. Thank you.
Well, I'll tell you what. So we had mentioned that between this meeting and the next meeting, we wanted to get your feedback electronically about the issues/barriers, as well as some possible solutions or goals. Let's add to that metrics. Not that, because this conversation, I need more time to think about it. And so the third thing that we'll ask for both enrollment as well as client experience is if you have any suggested metrics or outcomes that we should be trying to track, then let's include that in that survey that we'll send out.
That'd be great.
Yeah.
I think some of the program access reviews that Corey's talking about do go to, at least partially, to client experience. I would be very interested in seeing those.
Mm-hmm. Yeah, getting benefits in a timely manner totally impacts client experience.
I was just going to mention too for WIC, we have a participant survey right now that's out for current active families that are in the program. So I'm not sure when the results will be in. I would guess, I think the survey ends at the end of June. So probably a couple months from then. So we'll have some recent feedback. And then we are also at CDPHE with the WIC program working on we call ourselves the engagement team. So we're trying to get the client feedback on different things we might be rolling out, different projects, et cetera. Potentially some policies changes if we make them. So we have just started to meet and see what that process will look like and how we will engage clients. So have that feedback loop available for adoption.
Do you know if your counterparts at CDHS are exploring a similar type of client survey?
They did. Oh, I don't know about a survey.
Okay.
I'm just thinking that might be a recommendation of this
Yeah.
group, that we should have better data on client experience and ways to do that.
Erin, do you know when the WIC grant that was trying to increase enrollment, when those results?
The innovation grant results for all. I think maybe in January.
Oh, not till January.
Yeah, I think they're because programs are still finishing up the activities. I think they have a couple more months. I'm not on that group, but I think they have a couple more months before they wrap up that grant piece and then look at the evaluation piece.
Okay, thanks.
Yeah, so it'll be interesting to see that too.
So looks like we've got about 18 minutes left. We briefly talked about WIC and how to incorporate WIC policy recommendations in this process. I want to return to that for just a few minutes. Do you all think it would be better if we just had a separate meeting just on WIC, or is that going to inadvertently silo our efforts on WIC from SNAP? Is it, I mean, we genuinely don't know. We talked about this for a while about whether or not we should have a separate WIC group or a separate WIC meeting, or whether or not we shouldn't separate WIC from our SNAP work at all.
Or maybe the effort really needs to be around getting more like local WIC agencies to the table to join conversations. But I wanted to get feedback on how we could best incorporate or work separately on WIC.
Well, we have to turn in our state plans, our program manual, policy, and procedures every year. But you know, at that time, we try to review policies that
we have the ability to potentially change. Some are federally obviously regulated and don't have any wiggle room, and some have potentially a little bit of wiggle room. So it's hard to do a big policy review because sometimes you can't change any of them, you know. And so we just try to identify certain things that we might be able to streamline and make easier for clients. And so I know that we have a policy team. We'll be looking at the policy manual because it's due in August. So I could let you know if there's anything that needs feedback on that we are going to be reviewing.
You gotta be in July or August?
We would submit it in August, so maybe in July, but, and again, I'm not sure if there'll be a couple policies or none identified during this, but I will definitely keep you guys in the loop if there's anything available at this time to share.
So maybe if it would be helpful, we can have a WIC focused meeting where we can really dive deep into some of the policies that are under consideration.
Yeah, and I'll bring it to the policy team to see, you know, what's on the agenda in terms of that.
Okay.
Yeah, you know.
Okay.
Any other ideas or comments, suggestions about how we can make sure to include WIC as part of this group?
Well, we don't cover WIC at Colorado Legal Services, so I don't have WIC clients. I'm sort of curious as to whether the process is easier or more difficult than the SNAP process. I've seen what requirements 185% of poverty level, but you know, with SNAP you have, and it's nice to have the gapmap.org calculator. It'd be nice if clients could have access to that, because I have clients who get SSI and they're in subsidized housing and they don't understand why they're not getting very much SNAP. And the calculator would tell them why you're not, because you don't pay very much rent, really. But I don't know if WIC is the same process, if it's as difficult. I mean, maybe there's a different focus that has to be there. So I wish I could contribute to that, but I guess there are some people that wouldn't get SNAP that could get WIC. I mean, that seems to be right. But I don't know. Yeah, I don't know if it may just be a matter of letting pregnant women and recent mothers know that WIC's out there. I don't know if it's the same dynamic as SNAP.
So yeah, if a family is categorically eligible for WIC, so pregnant woman, breastfeeding woman, or child under 5 in the household, that's a categorical eligibility. But if anybody in the family, I'm generalizing, but is on Medicaid, SNAP, or TANF, that can income qualify them for WIC. So they don't have to necessarily bring in their pay stubs and all that. So a lot of it is letting people know. So if someone's applying for SNAP and they fall in that category, that they are also eligible for WIC. So we are, for instance, included in the Colorado PEAK application in different ways. So if someone's if someone's on SNAP and they're adding a baby or a Medicaid and they're adding the baby to their case, they'll get a pop-up saying, you may be eligible for WIC. Are you enrolled? You know, so we catch them as a program they can apply for, but we also catch them if they've already had a PEAK account and have life changes. So a lot of it is getting the word on, letting people know they are eligible and they can be on both programs at the same time. Once you're on the program, your benefit does not fluctuate based off your family's income. So pregnant women are going to get the same food package, basically amount. It's not going to be higher or lower depending on their income. Infants, children, you know, postpartum women. So they're all pretty much the same food package depending.
Are there similar problems with WIC as man in the house? We have cases all the time, and DHS certainly knows because we're on the other side, about clients who, you know, women who are claiming on their paperwork that they're not in the household with the father of a child or children. Yeah, but does WIC have that same issue?
Well, you know, if mom has Medicaid or the infant has Medicaid, for instance, it doesn't matter if the father's in the house and is making more than 185% because he's not getting any WIC benefits. The mom is, or the child is. And so if the family's not on any of those programs, then we have to look at the household as one for the most part. And so we would you know, take dad's income into consideration. And of course, there's times where, you know, I mean, their circumstances change all the time and they're so variable, you know, they might live with somebody but actually pay the majority of their own rent and the bills, and so you could look at them as a separate household, so.
Yeah,
But that gets into the weeds.
I think there'd be a lot of clarification to the process if somehow it were handled, because the man in the house cases are sort of, and I'm believing my clients, he wasn't living there. But the problem for proof for DHS is, well, he didn't have a lease anywhere else, and he's living with relatives, his mother or a friend, or it's like, well, he doesn't have a lease. I mean, you know, and then people claim, the relatives claim in the investigation by DSH, oh, he was never living here, and that's not so good for my client. But if, I don't know, I don't want to, if people have more to say, I know we're kind of getting to the end, but if there was somehow some different process where a mother came in, claimed she was only in the household, and then it's like, okay, there's a father to the child, is he alive? Okay, usually yes, he's alive. Where does he live? Or even if he doesn't have a lease, could he sign a statement about where he lives? Could the person with whom he claims to live sign a statement? I don't know. There's 100 ways to Sunday to do it, but I think that's a big frustration and process for a lot of people.
Yeah, I think we could definitely incorporate some of that when we look at, well, especially for the SNAP regulations, when they look at household composition, really clarifying and making sure that's done consistently from county to county through more clear regs. I would say, and anyone jump in if you have different experiences, but my experience doing application assistance and working with WIC clients is that some of the barriers are much less so about actually enrolling. Like, it's actually a pretty streamlined process from what I've heard from clients of, like, you know, if you are categorically eligible, and it seems like a lot are, that would be really interesting to actually know how many have to bring verifications versus how many are actually categorically eligible.
They all have to bring proof, so we have to prove that they have active Medicaid or see that they have SNAP benefits currently. So we always have to have proof of that participation. So that can be a barrier for certain things because they may, or proof of ID, they don't have those proofs as an issue.
Right. But I think what I've heard is that much more of the confusion and barriers tend to come on either the shopping side or on understanding that, you know, eligibility doesn't end when a child turns 1, and things like that, because, you know, even the name, we think of infants when we think of WIC. So some of those recommendations might be a little different, especially because it isn't the same enrollment process of like 3 different steps of applying and then verifications and then an interview. I think that piece is really much more streamlined. And my understanding is that Colorado is doing a lot of innovative things with WIC that we could also apply to some of what we're thinking about with SNAP. I think there are lessons to learn in both directions.
I think the main barriers with WIC are, you know, when the child turns 1, the food package amount goes down if the child was not on formula, so the family might feel like the work isn't worth the work. So to keep on the program to get to their appointments, you know, taking time off of work, and then the food package significantly less monetary value, they might find that they don't need that extra, or going out of their way to get it would be harder. So some of that keeps the kids from returning after 1. But yeah, enrolling is much more streamlined. It's just, you know, what it is.
Yeah, and that's what I've heard also, that the client experience with how, and I think there's real opportunities to coordinate the medical appointments and the WIC appointments. It would reduce work on both ends. If we could figure out some real models and it would be really patient-centric, because it would be easier. And it's even more than co-location. So how do you use the well visits as a time for an automatic WIC visit?
Right, because you can coordinate services and shared data
sharing. Yeah. So I think there's a lot of customer, and then the retail is a little tricky.
So we're looking at all
Right.
But I think it would really help to get that client experience too, as the Colorado Food Systems is working on, Advisory Council is working on improving the retail experience and the number of retailers who take SNAP and what benefits throughout the state. So getting that feedback would help that process also.
Okay. Well, it's a shame this is a great conversation, and I just realized we're running pretty short in time, and I don't want to shortchange it. In terms of our work on WIC, maybe we can plan on having a robust WIC-focused conversation in July. By that point, you might have the survey results back.
The survey results we'll just be getting them in and we'll be evaluating them, and then I'm not sure how long it'll take them to publish or release them. So, but by July for sure, I mean, we'll have reviewed the FRAC strategies, our regional tours, and at that point, I think we would have developed our work plan for fiscal year 20. So I can share with you what we'll be working on in terms of, at CDPHE in terms of WIC. So it'll include retailer, it'll include the client experience, so what projects specifically.
And so that will be a good point for us to see how we can support that.
That's a good time.
One other question I want to ask, I'm going to try to ask this at every meeting we have. Is there anyone else who should be at this table who's not here today that we should be reaching out to? Something to think on. If someone comes to mind or a group comes to mind right now, please let us know. But if you think of someone later, let us know. I mean, we want to expand this table to include anyone who's interested in helping support this work, really.
Yeah, and I don't even think we necessarily need to be go-betweens. Feel free to invite people to the table. And I think I spoke with Kevin, and it sounds like the most efficient way to do that is if you have someone who's interested, send their information along to Kevin, and he can get them connected to our work group, make sure that they're on the list, and even if they maybe can't attend meetings in person, can be receiving the information and weighing in however they can.
I just want to recap some of the next steps that we talked about today. Alexis graciously offered to take the lead on working with her federal policy team on a letter about the proposed change and how poverty levels are measured. Denver and Arapahoe counties both have offered, if there is preliminary data on the reentry pilot InReach program, that might be something that you'll share before next meeting. Perhaps most importantly, we're going to try to send out some sort of survey where we hope to gather what you all think are the most pressing issues, possible policies or solutions, as well as metrics and outcomes. And so that way, at our next meeting, we can consolidate that, try to figure out what's feasible, what we should prioritize. Corey is going to look into what kind of data he might be able to share on behalf of FNS. Sarah or I will share what CCLP's SNAP policy agenda is up to this point, just as a reference. Is there anything I'm missing?
I'll try to share some client feedback that we're slowly starting to gather in some form or another.
We still have 4 minutes. Are there any closing thoughts, comments, suggestions?
I was going to share the letter on improving access.
Yes. This is the letter to support the congressional bill that would, if passed, eliminate the work requirements, the time limits. Anyway. All right, this was great. Thank you all so much.
Really quick announcement, the Colorado Health Symposium, the Health Foundation's annual health policy conference, we've on registration just opened today. The theme this year is around affordable housing. So it's going to be a lot around the connections with other social determinants. We do sell out quickly, so if you're interested, that just went live. It's fun.
Thank you. Thank you, everyone.
Thank you.
Yeah. There was a single purpose application, yes.